It's time for us to dive into our first career in healthcare, pediatrics. Pediatric healthcare careers are some of the most rewarding in healthcare. Let's meet two pediatric professionals and learn about a few of the many options in pediatric healthcare.
The biggest driver for me to get into this field is that in pediatric surgery, we get to follow our patients for many years. Early in your career, you meet someone who has a cleft lip, and then for the next 18 years, you're going to grow up with that person and that family. You grow as a surgeon, but you also get to watch the kids grow. My name is Adam Goudreau, and I am a craniofacial surgeon here at Children's Mercy. The problems that I address in the plastic surgery clinic and the craniofacial clinic range from fixing cleft lips and palates for newborns, fixing children whose skulls were formed a bit differently, all the way through middle childhood into adolescence and early adulthood. My approach to patient care is primarily to function as an educator. The work that I do, the anatomy that I operate on can be hard to wrap your head around. And so when you come to see me in clinic, my first goal is to make sure everyone's comfortable and relaxed. My second goal is to make sure that you leave that clinic visit with a deep understanding of the problem, what the possible solutions are. The team focus is so critical. I'm only one small piece of the puzzle. Most of the children who come to see us are going to need to see, a dozen specialists at some point in their life. And we have concentrated those specialists into one place so that the families aren't having to make a dozen drives to the hospital. It is immensely stressful to walk through life with a facial difference. And in a small way, our clinic helps to equip families not only with the surgical interventions that are going to make that a bit better, but we're also counselors and cheerleaders. And so we get to guide you through those difficult years when your child might be having some stressors at school. What's inspiring about it is as you watch those families grow, you see the confidence come out of these children. You see the tool sets develop in the kids, their parents, their support system. And a lot of our families, most of our families, are incredibly inspiring in how they tackle the world. They won't be stopped just because their face looks a little different. And so getting to see that every day and interact with those families is really special.
Kids are just awesome to take care of. They really just want to get better, get back to jumping on the trampoline, playing sports, being active, and I think it's cool that we play a role in making that happen. I'm Ryan Kaler. I'm one of the pediatric orthopedic surgeons, and I'm the division director of sports medicine. At Children's Mercy in our sports medicine division, we take care of all athletes. We'll see patients basically that span the whole age spectrum, from young patients all the way up to college age athletes. Anything from fracture care to like sprains and strains, all the way up to folks that need complex cartilage reconstructions. We'll take care of all those things. My approach to patient care would be trying to help everyone in the room understand what the plan is, and I think that's my job as the provider. We present treatment options and treatment strategies, but ultimately my goal with patient care would be that we all make a collaborative decision on what's the best direction to move forward. The thing that sets Children's Mercy apart from a sports medicine standpoint is really our team-based aspect of care. We have everything from sports therapy to athletic training. We also have sports psychology and sports nutrition, and so we can take care of the whole athlete. Small athletes aren't just small adults, they're really pediatric and adolescent patients that have different considerations than what some of the adult sports patients need. The thing that inspires me about what I do on a daily basis is just seeing folks achieve what they want to after having a traumatic event, whether that's recovering from like a simple fracture that you get casted for, or it's doing a year of physical therapy after an ACL reconstruction. There's no better feeling than high-fiving a patient as you're telling them, you don't need to see me again, which is kind of a weird dynamic, but it's a cool experience.
I want to welcome our panel to answer questions about some of the many career opportunities in pediatrics. Joining us this morning from Children's Mercy is Dr. Adam Goudreau, plastic surgery, and Dr. Ryan Kaler, orthopedics. Good morning.
Good morning.
Yeah, good morning. Thanks for having us.
Well, my first question for you before we get into the chat is, will you each take a turn telling us about what drew you into a medical career and pediatrics specifically? Dr. Goodrow, let's start with you.
Absolutely. So, when I was in college, I was interested in science, and that always captured my interest. I was good at it. It's fun to be good at things. So you kind of engender that interest further and further. But as I looked at kind of more benchtop science, the thing that I was missing was connections with people. And so healthcare really is an opportunity for me to get to know kids, families, people at all different stages of life. And we're blessed in pediatrics that we get to make kind of longer term connections to grow up with kids. And we have a live progress.
So what about you, Dr. Kaler? What really drew you into the medical career?
I think for me, I was an exercise science major, and I really liked the applied aspect of biology. Was interested in science, but I think the applied nature of it really transcends well into a medical career. And so kind of pursuing options, that was what led me down the path of going into medicine general. Orthopedics, I'd have kind of the classic story, got hurt playing football in high school, and so had a surgery related to that, which led me to kind of think about orthopedics as I pursued a medical career. But pediatrics specifically, I would agree. I think being able to kind of grow with the kids and follow these interesting, sometimes very strange disease pathologies that we see unique, but it's also really exciting because we, on the orthopedic side, can intervene kids that are very different than how we fix problems if folks are adults.
So could you each tell us a little bit about your specific education that you received? You alluded to it here a minute ago, but what training was involved to actually specialize in the pediatric side of what you do? You want to start, Dr. Kaler?
Yeah, so for pediatric orthopedics, typically you will do medical school, which depending on where you go is 4 to 5 years typically. Then you do an orthopedic residency, which is physical residency, that's 5 years. And then most folks will do a pediatric fellowship after that, which is another additional year of training where you focus on pediatric specific conditions. Within kind of that training realm, you sort of like subspecialize a bit at each level so that when you come out into practice, you're very kind of specialized in what you're able to do, but very unique to children, what you're training in.
What about you, Dr. Goodrow?
It's pretty similar. So both Dr. Kohler and I are surgical subspecialists. So our training pathway is a little bit longer. Similarly, 4 years of undergraduate followed by 4 years of school. And then I did a 6-year residency in plastic surgery, and then an additional year of subspecialty training in pediatric plastic surgery. The range of pediatric subspecialties, the time that it takes to get from undergrad through the finish line varies. Your office-based general pediatrician is going to spend a little bit less time than a surgeon, but in general, it's plus or minus 4 or 5 years.
Well, I know for me, I'm wondering, like, you mentioned this in the video a little bit, but what are some of the most rewarding aspects of the work you do in pediatrics and your specialty specifically, either one of you?
Yeah, I think orthopedic wise, I think fracture is very rewarding. For me, I like to see a problem and fix it. And I think when we have broken bones that we take care of, like the best example would be an elbow. Usually we'll see kids with elbow fractures from trampolines or from falling off the monkey bar. So with the weather being nice, that tends to lead to those injuries happening. And, as we fix that problem, you have a really unique opportunity to take something that's very damaged, injured, and make it better and almost instantaneously see that that's going to be a good outcome. And so I find that really satisfying with what I do.
Yeah, on my side of things, I'm treating specifically kids who are born with facial differences or acquired a facial difference through trauma. And that it requires different hats, one of which is kind of being a psychologist and navigating the world with the facial differences, helping empower kids to kind of lean into those differences and build their confidence. And as I get to watch kids go through those sometimes challenging middle school years where things are changing in the context of a facial difference, seeing their confidence come out of that is really rewarding. And knowing that it's the happy side of medicine. I get to kind of wave a magic wand and try and make things a little bit better for a kid. It's really awesome.
Yeah, I would imagine that is very rewarding. What advice, we got a lot of folks on the call today that might be thinking about pediatrics as a career. So what advice would you give individuals looking into careers in either in pediatrics or pediatric surgery?
Yeah. So any young person who comes through looking for advice, I kind of give the same general advice, which is to keep an open mind. An event like this is great because healthcare is a massive enterprise, and there are just dozens and dozens and dozens of different ways to touch this career. And you find something that you're really passionate about. You know, it's a very like classic tale, pursue medical school, but in that you may find that nursing is really what kind of resonates with you, or phlebotomy, or being a therapist. So all throughout this, so if you're leaning towards healthcare, that's awesome. But as you do, you keep your eyes open to what's out there, because you might be surprised what after your eventual career entry.
Yeah, I think we kind of tell families and patients the same thing when we see them and have this question come up is I kind of tell folks to keep an open mind, but also pursue different interests as well. I think like the best example would be, I see a lot of athletes in clinic, but if we get asked this question, I'm honestly like encouraging them to pursue things outside of athletic pursuits. So per se, do things that are a little bit different than what you're comfortable doing, because those that you learn sort of stepping outside of your comfort zone will help you as you pursue a career, but it also might just spark an interest in something that you would have never tried if you had sort of stayed in your kind of comfort zone. I think the same thing applies as you look into healthcare fields. Like you might find that one field within healthcare is more appealing than other fields as you sort of like do events like this and start to shadow and do things like that. And so I think, keeping an open mind and pursuing different options would be some advice I would give folks on the call.
That's great. Well, thank you guys so much. I know Jaron is monitoring the chat, so I'm going to turn it over to Jaron to see if he can share with you some of the questions we're receiving from the chat. Jaron?
Yeah, thanks, Cindy. And this was a great way to start things off this morning. We have quite a few questions coming in the chat. And so the first one that someone is asking is, for both of you, what are the most challenging parts of your careers and your professions?
This job is not without its challenges, for sure. It's the happy side of medicine, but it's not lost on any of us, particularly in surgery, that we're taking care of kids, taking care of families. Not everything in medicine goes off without a hitch. Sometimes we have complications. And so one of the most challenging things is kind of living in those complications, not shying away from doing the important work that kids need to fix difficult problems, and kind of being able to march on and continue to pursue those difficult cases, even though you maybe had a complication last week. That's probably what weighs on me the most.
Yeah, I think when we try to fix a problem and there's not a solution for it, if we have a bad injury, like a bad traumatic injury where you can't go back to 100, I think those sometimes are challenging situations, but trying to make the best of it and just really help families navigate those complications or those challenging situations. I think that can sometimes be a quite stressful situation that we find ourselves in, but just being able to navigate that and hopefully get to a better outcome than where we're at we start is sort of how we try to navigate those challenges.
Yeah, no, those are, I'm sure, very things you often might see, but like you said, that's part of this role and part of this profession, but it speaks a lot to the type of people that we need to be able to serve and deal with those things day in and day out. But maybe that ties a little bit into one of these other questions we've got in the chat. With some of the procedures and services that you both are seeing, I'm sure it might be a little bit different, but how might you handle situations when a child can't explain when something is wrong, or maybe there's something deeper in this under the surface that's not so obvious?
Yeah, sorry, the video connection cutting out, but I think we got the gestalt of the question. So, in general, me in particular, I treat children of all ages. There's a slight slant towards like preteens, teenagers. And communication some varies depending on whether you're treating a toddler or a 6-year-old or a 16-year-old, and how it varies is very dramatic. There are a lot of resources here at a big children's hospital that we can lean on. One of them is a healthcare career called Child Life. And they're a group of people with college degrees that really specialize in breaking down those communication barriers for even very young children who are 3 or 4, as well as older kids who are trying to navigate the healthcare system they're kind of on their own with their parents in the room, and maybe they don't feel great about that. And so there's a lot of tools and specialists that we can kind of pull into those conversations in order to make it smoother.
And I think one of the unique things about pediatrics in general is just want to get better. Like they just want to get back to doing what they were doing, whether that's, playing on the monkey bars, jumping on the trampoline. And so a lot of times they're going to be pretty straightforward about what's wrong. But I think also trusting families, because obviously the families are with the patients day in and day out. And so if we have a mom that shows up to clinic that's concerned, we're going to take that very seriously and kind of pursue that fullest to make sure that we're not missing something, because children are unique and that they can have strange things that come up from time to time, and just looking for that we're kind of follow those boxes.
Yeah, no, those are both really, really great points. Well, so the next one then, how do you make children feel less scared in a medical setting? It's intimidating for adults, and I'm sure it just is even more so for children. So what does that look like for you and your teams?
Yeah, so I think for me, because we see this a lot with the fracture care that we do, I have young kids, so I try to relate to patients based on what stuffed animal or what blanket or they have. So personally, I'm very familiar with Bluey and Paw Patrol right now to try to make connections with kiddos and families that way. But I do think trying to find some common feature that you have with the patients or the family, or just something other than the injury or fracture, the problem that they're seeing you for, and trying to break it down on their level is sometimes a good way to break the ice, but also a good way to get kind of patient comfort with what's about to happen with procedures and things like that.
Yeah, and a lot of what we do, kind of traditionally, we think about seeing things through the lens of the parents, because that's often the biggest voice in the room. But even very young kids have opinions and thoughts and personalities and anxieties. And so really trying to just kind of meet them where they are and talk to them like the real human beings that they are can be very helpful. They have a lot of thoughts, and if you can tease out some of those anxieties, you can put a lot of stuff to rest. A lot of stuff gets kind of just, the anxiety builds up, and once you kind of know what's really going on, you can really start to break that apart. So it's important to treat not just the parent, but also the actual child that's in front of you.
Sure. Yeah, it's a family affair by no means. So maybe we're coming up at the end of this segment, but the last question, we'll bundle this for you both. Or I guess number one, how many patients do you typically see on a day-to-day? What does that look like from your side of things? And then also, I think this was hit on a little bit in the video, but maybe just remind folks, what are the most common procedures, surgeries that you specifically do in both of your specialties?
Yeah, so for me, typically a clinic is a full day, and I'll usually see about 35 patients in clinic. For surgery, we usually do 3 to 4 surgeries on a day. My schedule looks like 2 days clinic, try to have 2 days in the operating room, and then a day we teach residents and do some administration. So a day kind of working on education type of thing. And then, typically surgeries for me, my most common ones that I do are probably ACL reconstruction, so a torn ligament in the knee, shoulder stabilization, so, folks that dislocate a shoulder that need the room fixed, and then probably fracture care would be the third most common thing that I do. So fixing femurs, elbows, ankle, things like that.
In my clinic, the numbers are a little bit smaller. So a lot of our patients who come to us with facial differences, that typically, not always, it can happen in the context of a bigger kind of syndrome, lots of other medical problems. And the burden on families to go to a dozen medical appointments is not small. So we kind of structure things in cranial facial surgery, plastic surgery, where we have kind of, we call them visits or multidisciplinary clinic visits, where you might come in and see 6 healthcare workers, whether it's the surgeon or an orthodontist, a speech pathologist. And because of that, the conversations about kind of very complicated long-term treatment planning. So I'll usually see on a multidisciplinary clinic day, I'll see 12 patients in the morning, and then maybe another like 15 in the afternoon of kind of more standard clinic care. The most common procedures that I perform are kind of things related to cleft lip and palate. The kids who are born with kind of a deficiency of tissue in their lip or the roof of their mouth. I do a lot of work with older teenagers, young adults, correcting misalignment of their jawbones. For infants whose cranial shape, like their head shapes are a bit different, we do surgeries in partnership with pediatric neurosurgery to reshape those. And then a lot of bread and butter, plastic surgery stuff, taking out molds and making the incision look pretty as we can. The single greatest thing, like the single most common thing that we do.
Well, I'm sure we could spend probably the whole morning talking with you both. There's a lot of other questions we weren't able to get to, but thank you. But we're out of time. So Cindy, I will turn things back over to you.
Thanks, Jaron. And thank you, Dr. Goodrow and Dr. Kaler, for sharing your insights on careers in pediatrics.